Good morning, everyone. I am Sajida, working from Emmanuel College of Nursing. Today we are discussing about the class second year BSc Nursing, third semester, subject Adult Health Nursing 1, Unit 4, Respiratory System. The topic Pneumonia. Definition of the pneumonitis is an inflammatory process in which lung parenchyma usually associated with a marked increase in interstitial and alveolar fluid. Pneumonia is an inflammatory process in lung parenchyma usually associated with a marked increase in interstitial and alveolar fluid. Etiology and risk factors. Many causes they have to cause the pneumonia: bacteria, virus, mycoplasmas, fungal agents and protozoa. Aspiration of fluid, food or vomitus, inhalation of toxic or caustic chemicals, smoke, dust or gases. Major risk factors: advanced age, history of smoking, upper respiratory infection, tracheostomy, intubations, immunosuppressive therapy, non-functional immune system, malnutrition, dehydration, chronic disease status like diabetes mellitus, heart failure, chronic lung disease and cancer. Additional risk factors: exposure to air pollution, altered consciousness from alcohol, drug overdose, general anesthesia, seizures, inhalation of noxious substance, aspiration of food liquid, foreign or gastric materials. Classification of pneumonia. Based on the area involvement, they have to classify two types. First, based on the area involvement, and second, based on the causative agent. The causative agent again they have to divide it to bacterial pneumonia, atypical or non-bacterial pneumonia. Then pathophysiology. Risk factors. According to the etiological factors or risk factors, major or additional risk factors leads to the inflammatory pulmonary response to offending organs and agents. Then leads to the defensive mechanism of lungs lost. Then leads to the organisms penetrate heat sterile lower respiratory tract. Then leads to decreased mechanical defenses of cough and ciliary mortality. Then leads to the colonization of agent in the lungs, leads infection or inflammation and fluid filled the alveolar sac. Then leads to the ineffective exchange of carbon dioxide and oxygen. Then lung exudate with consolidate, leads to the ventilation or ventilation perfusion is mismatched. Finally, they have to cause to the pneumonia. This is the pathophysiology of pneumonia. Next is the clinical manifestation. Clinical manifestations of pneumonia: fever, chills, sweat, pleuritic chest pain, cough, sputum protection, hemoptysis, dyspnea, headache and fatigue. Then if you do the physical examinations, chest auscultation, bronchial breath sound over the consolidate lung areas, crackling sounds from fluid in the interstitial and alveolar sac is present, increased tactile fremitus over and the end of pneumonia, whereas percussion sounds are dull, unequal chest wall expansion during inspiration, whispered pectoralogy, transmission of sound whispered words through the chest, heard over the affected areas. Diagnostic evaluation: sputum culture analysis and sensitivity or serological test, fibrotic bronchoscopy or transcutaneous needle aspiration. Cytology. Then chest X-ray, Next, additional diagnosis test, skin test for tuberculosis, blood and urine culture, arterial blood gas analysis. Next, we are discussed about the medical management of pneumonia. First, broad spectrum antibiotics. Example, ampicillin, cefuroxime, augmentin. Next, respiratory support. Next, bronchodilator medicine and chest physiotherapy. Next, fluid and electrolyte management. Next, symptomatic treatment for fever and reduced pain by analgesics and antipyretics are given to the patients. The nursing management of pneumonia. First, assessment history of contact with a similar infection. Rule out other diseases, example pulmonary embolism. Lower the level of consciousness. Presence of tuberculosis, chest pain, cough and sputum. Nursing diagnosis, ineffective airway clearance related to decreased cough reflex secondary to disease process. Then increased fluid intake, encourage and teach effective coughing and deep breathing exercise, side lying position, bronchodilating agents, sex physiotherapy, artificial airways. Then ineffective breathing pattern related to tachypnea secondary to disease process. Raise the head of the bed to elevate 45 degree. Teach the client how to splint the chest. Cough suppressant and analgesics. Monitor ABG, chest auscultation, incentive spirometry. Activity intolerance related to decreased oxygen level for metabolic demands secondary to disease process. Reassess for marked dyspnea, physiological, psychological support and quiet environment, post lip breath, chest physiotherapy. Thank you.